Good afternoon and welcome to the second half of our big day of training here at Compression Care. In this session, we're going to be talking about how to optimize garment selection now that there is a new written Medicare standard for the at-home maintenance phase of care. I'd like to introduce you to Claudia Dixon, our senior case manager here at Compression Care. I'm Steve Lewig, one of the co-founders, and we're happy to be joined by all of you this afternoon and to have you as part of Big Day of Training. It's been a really exciting morning, and I know we have just as much planned for the afternoon. Hopefully you've gotten to see a few things and enjoyed what you've gotten. We got some really interesting stuff to share with you in this session, and it's going to be lots of Q&A opportunities. So as you get as the questions come up, drop them in the chat and we'll make sure that we get all of those answered as we go today. We're also going to be providing you with some links, and at the end we'll have a QR code. If you have your phone ready, we'll have a QR code for you to be able to get to a resources page that has everything we're going to show you today. But you can also download it right from the chat. There's a link in there right now that takes you to the resource page. There's also a link to our Microsoft Teams virtual lounge that's going all day today. We've had lots of people in and out of there. Members of our staff are in there, and they are available to say hi, to answer questions for you, to point you in the right direction on stuff, and just generally hang out with you. So we've had some good opportunities to put faces with names today, and that's been really fun. So I'm glad everybody's using that, and we're looking forward to spending hopefully a good bit of the afternoon here with you. Again, if questions come up along the way, put them in the chat. We'll make sure we address them. We'll try to get as many of them on the fly, but we'll make sure before we're done we have them all answered. All right, so we can probably agree that the implementation of the Lymphedema Treatment Act, or LTA, has been a really great thing for our patients. I think this session is about thinking through all the other implications of that change. The great news is that many more patients have coverage to help pay for compression garments, but we also have to stop and think about how a written standard changes some things that we've always taken for granted in our industry. It changes garment planning, it changes documentation, and it changes your professional risk. We're going to talk about all those things in the next few minutes. And we've made a number of cheat sheets to help you with simple adjustments to make going forward. So we'll be showing you those, and we'll be making those available so that you can download them either right out of the chat, or at the end you can kind of connect to the whole thing. So Medicare has defined the at-home maintenance phase to consist of day and night garments and then accessories as medically necessary for desired outcomes. And as we consider how that plays out so far, the big change is that they've now specified a number of garments per body part and the time period in which those get replaced. And you're probably very familiar with those by now. 3-day garments per affected body part per 6 months on replacement. What I want to share with you today about how we recommend dealing with that is when you're doing day garments, order all 3 at once. We have a lot of people that are ordering 1 for fit and then trying to come back and order 2 more. Order all 3 at once. If they're ready to wear, we're going to ship all 3. And to be honest, it's just as easy to return 3 as it is 1. And it saves us because we end up paying the shipping twice. If you do it once, if you ship 1 for fit and then 2 more, it's much more cost efficient for everybody, us and the manufacturer, if we can just ship all 3 at once. And it's just as easy to return 3 as it is 1. So if you don't mind making that change, that really helps everybody in the whole chain. It means we deal with the patient on collecting coinsurance once. It means we deal with the manufacturer once. It means we only pay shipping once. So we really appreciate when you can follow that best practice. If they're custom, go ahead and order all 3. What we will do is we will place an order we will ship 1 for fit, and then we will ship the other 2 only upon approval. So that way, we still only have to deal with collecting from the patient and doing all of those details once, and yet we will not waste garments and risk having remakes that none of us wants to deal with. So we will, if they're custom, we'll ship one for fit, and we'll ship the other two immediately upon your approval, because the measurements and everything are already in the system, and it's really easy to do that. Garment selection on night garments, 2 per affected body part per 24 months. Order both at once. Same process for ready to wear versus custom. We're not going to ship 2 customs. We'll ship one. We'll ship the other one when it's approved. Or you can order one now and one in 12 months. What we're finding is that patients, and sometimes you as the therapist, have a preference, and it really does. I think we want it to be whatever makes you and your patient comfortable. Either order one now and a fresh replacement in 12 months, or order 2 so they have one to wash, one to wear. I think it comes down to what the patient finds to be best for them, and whatever's gonna help them be most compliant. Sometimes a patient likes having one to wash, one to wear, and feels like they can keep it cleaner and all of that. Other times, after a year, they're just like, I want a fresh one, get me a new, and maybe they've changed their mind on the color, or maybe there's something they want to update. And so we leave that completely up to you. And it really comes down to the preference of the patient, but don't feel obligated to like rush 2 out there but if you're going to, definitely order them at the same time. And so garment selection cheat sheet, we've put all this we've put a couple of like common scenarios, what has become kind of the standard, if you will, like a baseline Medicare order together. And what you also can take away from this is that it also helps you understand how things like, as we get into wraps, how Medicare is treating wraps. I want to make sure I'm done before I move on from that slide there, Claudia. What did I do? And we've created the cheat sheet that lays it out, and we're putting a link to download it right now. These will be available at the end. So if you can't download it right now, don't panic. We'll have it for you, and you'll be able to get it. You're also going to get an email tomorrow that has links to all of this. So we'll make sure you get it. If you haven't, if this is any of this so far, we're still in the basics. So if you don't have questions yet, it's okay. But as they come up, make sure you're putting them in the chat, and Claudia and I will make sure we're answering you on those. So we get a lot of questions about one of the most common garments that has just exploded in popularity is Velcro wraps. And some of this is being driven by, there's a lot, and it varies all over the country, but there are therapists who are being told they can't bandage anymore. There are all kinds of reasons why Velcro wraps have come into really heavily into favor. It's also just the versatility of the wrap, and you can use a Velcro wrap early in your treatment process for reduction, especially if you're being told that you can't bandage or bandaging just doesn't seem practical in a certain situation. Wraps have become a real go-to in that regard. Wraps, reduction kits, and so the challenge is that Medicare counts those by default as a day garment, and it's important to point out at this point that these numbers we're talking about are all the Medicare standard, but it's important to know that some commercial insurances cover that number of garments, some cover less garments, some cover more, several cover more garments, and some cover no garments. Right. I'm speaking of United Healthcare commercial right now. And so you can always check with the when you're submitting a referral, you can always make note if the patient has expressed an interest in more than 3 or more than 2. And some insurances can process more, but
Right.
it's really on a case by case basis. And you can't even say like Cigna will always do that, because there's no always anymore. All these plans have so many variations that it's a case by case basis, and there's very little advice we can give that would be universally acceptable. But if you are using Velcro wraps as part of your garment plan, by default, they get billed out as a day garment. However, you're not limited to that strategy, okay? And we've created another cheat sheet specific to possible ways you can factor wraps in. If you dispense a Velcro wrap with a pad or a swell spot, and Claudia, maybe you could give some examples of like which products those are, but if you order it, if you want it to count as a night garment, just when you send your order to us, request that it be combined with a pad or a swell spot and count it as a night garment, because then that way, if you go ahead.
I was going to say, right. Yeah, the pad or swell spot depends on the limb that you're actually, or the part of the body that you're actually using it for.
And our
but we
case
could definitely
managers
help
all
you.
know which to recommend, right?
Right.
Okay.
All of the case managers can help you, guide you, as if you're not sure of which one to pick.
Yeah, and if you have specific questions or a specific scenario that you want to, I'm going to put Claudia's email up here right now. You can always just shoot her a note, and she'll be happy to to follow up with you on that. But you have the option to count it as a night garment, but it's helpful if you're counting on that, it's helpful to let us know that that's what you're planning, and then that way we can accommodate it correctly. The Velcro wrap cheat sheet, I'm going to drop that. I'm going to drop a link to that into the chat right now. And what that one allows you to do, it just kind of gives you for example, some scenarios. There's 4 different scenarios there that we lay out that are really give you some options in terms of where'd it go? Here we are. I wanted to make sure it showed up in there. It gives you 4 basic scenarios where it shows you how it affects the overall mix of the garments you should recommend, or that you can recommend, especially against the Medicare limits when you're factoring in wraps. And it gives you a couple of different ways you can approach that. And if you have specific questions about any of that, just drop them in the chat, and we'll make sure that we're following that up with you. That cheat sheet, like I say, all those cheat sheets are going to be available at the end, and we'll be able to walk you through there. I just messed my whole desk up. For example, a very common scenario we're seeing these days is you order a wrap very early in the process for patients to use for reduction. And so you can order this with a pad or a swell spot, ask us to count it as a night garment. That still leaves you 3 day garments. You have 1 to wash, 1 to wear, 1 for the drawer later. Or you can run through a scenario where you dispense it as a day, and then you still have 2 more day options when you fully transition the patient, so they have 1 to wash, 1 to wear, and then 6 months later we can start increasing their arsenal and keep refreshing with new ones, and then adjust the mix. So sometimes you might want to start with a wrap and 2 day, and then 6 months from now you just go to 3 day if they don't need the wrap anymore. But what we're finding is patients really respond positively to having that wrap available. Mm-hmm. And they'll say things like, if I have a really bad day, I'll just, I'll use the wrap to kind of reduce myself back down and get myself back under control. So Velcro wraps are a wonderful tool in the toolbox. And what we find is that patients often really like having that sort of variation of garments available to help them based on what they're experiencing.
Right. And some days it's actually the wraps are easier for a lot of patients to don than the regular
Yeah.
stocking. So
And
some choose
especially
those.
people who are not heavily mobile, elderly, people who are obese, that can be much easier than trying to don, a regular garment. Yeah, definitely. That's great advice. The second area where the new standard affects you is plan of care. And during the second half of this last year, all of the dealers around the country have been undergoing initial audits called TP&E audits from Medicare. And the idea is Medicare is auditing the new codes, and it's to be educational for them and for us so that we can learn to make sure that we're all on the same page going forward. And it's revealed really three primary things that we were not on the same page about. And a couple of them flat out contradict the training that Medicare provided on the front end. But it is what it is. And so what we're working on is an industry-wide dealer-driven standard. And what you'll see that coming in the next few weeks and months. But in the meantime, the two things that really affect plan of care about these that we're learning from these audits is it's important that the plan of care reflect a garment strategy that meets or exceeds the Medicare standard. Okay, and these TP&E audits have identified two particular weaknesses in plan of care. One is Medicare wants a lot more written justification for customs. So when you're going to order custom, and we always encourage custom whenever it's justifiable, because patients just, the fit is better. Patients are more likely to use it. It's just better all around. And so we've put into a modern plan of care cheat sheet, which I'll give you the link to in a second. We've put some sample language in there that is based on the language that was used in audits that were successful versus language that was either non-existent or failed the audit. But just giving you some basic, putting a statement in there that explains why custom is appropriate. And Medicare has identified, essentially, they've defined 4 scenarios where it's appropriate. And so we've provided you with some guidance and some ideas on how you can word, your justification in your plan of care. The other area that they have really been hammering dealers on is accessories. And so putting written justification for why certain accessories are being either added to the garment, in the case of like a silicone band, a zipper, a dart, or whatever. We want you to include these for patients, but we also want to make sure that in the plan of care, we're writing in there why they're indicated. And Medicare has been real sticky about making sure that there's a medically justified reason. And, like the patient asked for it isn't enough. So we have to say medically, and we've put some sample language into this cheat sheet. I'm going to put the cheat sheet up there just because you're probably wondering what else it says. And we've put a lot of samples in here so that you can so that you get some guidance on how to do that. And we're continuing to collect best practices from not only our own audits, but we're part of a new group called the Compression Dealer Alliance. And Compression Care and several other national billers and some regional billers have created this organization to work hand in hand with the Manufacturers Alliance. In fact, Carmen from the Manufacturers Alliance is also representing the Dealer Alliance. And we're working together to come up with a consistent voice to all therapists so that you can feel comfortable that what you're doing, it doesn't matter whether you're sending it to compression care or any other biller, it should meet the unified standard that we're working to agree on. And it's all based on the feedback we're getting from Medicare. And I would say overall, there haven't been any massive shocks from those audits, but it's definitely highlighted some areas where we've had a lot of failed audits as an industry, and Medicare has made it clear that it's not us, it's you. when the dealers, it's not our fault, it's yours. And so things like when you're going to include, say, a maintenance kit, skincare treatments, just writing, putting written justification for why those things are being included. And when we talk about meeting or exceeding the Medicare standard, adding things like a care kit, adding things like skincare, even if the patient ultimately chooses not to purchase that, your recommendation has been very thorough. And that's something we're going to talk about next. This Modern Plan of Care cheat sheet has a couple of really, really helpful suggestions in there. And of course, anytime you're talking about compliance documentation, it's really important that I wouldn't just go by what we've provided in this cheat sheet. I would make sure that you're consulting your compliance team at your clinic, your hospital system, and making sure that their standards might even be higher than ours. Kelsey's asking about what a maintenance kit is. Maintenance kit often consists of the laundering bag, the detergent that launders the garments, and sometimes we'll include other such items. And
sometimes it's a donning glove.
Donning
gloves are included. Laundry detergent, the bag.
Yeah.
Usually that's kind of, when he says maintenance kit, I think he's meaning for the garments themselves.
The care kit. Yeah, the care kit for the garment. Yeah, for sure. And the other and related to skincare is particularly like when you're dispensing a night garment, or particularly with night garments, but any garment, if the patient already has existing skin issues, when they're going to be wearing a garment constantly, being proactive about addressing the skin condition. And, there are now any number of manufacturers who've created skincare that is very specific to lymphedema and designed to help with any skin irritation that might happen as a result of wearing the garments. As you know, sometimes, and most of the manufacturers are moving very quickly to address this and add features to the garments that overcome this. But often, particularly if you're wearing a night garment, it can be real. It can feel what's the word, Claudia? It can feel airflow gets really heavily diminished, and so you'll have people who feel the need to remove it in the middle of the night or
because
situation like that. And the skincare, a lot of times the skincare can help alleviate irritation that happens as a result of that. So when I say maintenance kit, I mean the care of the garment, the laundering of the garment. And then when I say skincare, it's like skincare that is specifically indicated in situations where the patient maybe already has a skin condition and or develops one as a result of wearing garments.
I think one example of that might be if your patient does have skin irritation or some very sensitive skin, like you might want to order a compression and custom garment that has silver in it. For sure. Antimicrobial and antibacterial. And so documentation just for why you're wanting that particular garment. Because
silver is a pretty significant upgrade. And so we need to bill that as an accessory. And so silver and silver can be a really amazing. I mean, there's certain, with burn patients, I don't think we ever do anything that isn't silver, but it's silver has some amazing properties. And if you haven't ever tried it, it can be really helpful in situations like that. Andrea is asking if we bill for the maintenance kit as a package, so it's an accessory. Not every insurance company will pay for that particular accessory, but Medicare, you can bill a care kit. Medicare and Medicare, you can bill.
Yes. So it also depends on the manufacturer. I do know that
different manufacturers offer different products.
Yeah, there might be one or two.
Some of them are considered universal, like regardless of the manufacturer of the garment, it would work. Right. So yeah, you can always just indicate it, and then we can, depending on the patient's, Claudia can explain this, but it's better if you order everything in your plan of care, and then obviously we always work with the patient to determine what's important to them. Do they feel they're going to use it? If they don't feel they're going to use it, then they don't need to buy it. And that kind of all dovetails into the last part of our conversation, which is professional risk. One of the things that is an area affected by the fact that Medicare now has a written standard, and you could think of this as like CYA or cover your butt, but we all have professional risk associated with treating patients, physicians, you as the therapist, manufacturers, even us as the dealer. And for physicians, they have to always make sure they're following the AMA treatment standards. For you as therapists, making sure your plan of care and your consultation with the patient for your active treatment phase, and then your recommendations for the at-home maintenance phase of care become equally important. Many of you, I know, are extremely protective of your patients, and we appreciate that. We share your sort of mama bear instincts about that. And when it was the Wild West out there, that wasn't really as critical. It was critical for you to advocate. Today, it's no longer the Wild West. We've now got a very clear bar that's been set, and with this new Medicare standard. And it will only be a matter of time before a smart malpractice attorney figures this out. So making sure that your recommendations meet or exceed what Medicare says, takes away from any risk you have. Because let's say you recommend 1 day garment. Medicare standard is 3 day, 2 night per body part. You recommend 1 day garment. Well, that person, everything goes sideways. It only takes a matter of time for that attorney to go, well, wait, why did we only do that when this was what was called for? And that's new. That's a new way of thinking about all this, for sure. And I doubt that it's come up very often, but it's a really strong implication. And now that Medicare has established a standard, when it was just the commercial insurances paying, they all had their own standard. Now Medicare's come in and established a bar. And so this whole conversation is about making sure that we're reacting to not just the fact that more patients are now covered, but what is also the implication for you as the therapist, for us as the dealer, for the referring physician. And I think you're asking, I think you're asking for trouble if you're not following the standard. It begins with recommendations that meet or exceed Medicare's, and then making it solely the patient's decision to do anything less than that. That's how all of medicine works. You're recommending what needs to happen, and if the patient chooses anything less than that, that's on them. So these are conversations that we have with patients all day, every day. It's like patients need to make their own decisions, including what they can and can't afford. Our case managers, we spend a lot of time training on like how to help the patient arrive at what makes the most sense for them financially. We've also done a lot to be help them make informed choices, and we've instituted things like our lowest out-of-pocket cost guarantee. Anytime their out-of-pocket costs to use their insurance benefits exceed what it would cost them to buy at the lowest retail price allowed by the manufacturer at Compression Guru, we automatically are showing them that option. And that way, patients never going to pay more than they have to, and they can make the best decision for themselves. The other things that we're doing to make, to deal with the affordability question is payment plans. If you buy, if the patient's buying from Compression Care, they can break their out-of-pocket costs into 3 equal monthly payments. If they're buying from Compression Guru, we now have partners in Klarna and Affirm that will break their purchase into 4 payments. And they have a lot of control over like how long they break it out into. So it's important that you start with at least the baseline, if not better, recommendations, and then let the patient make their decisions based on what they think they're going to use, what they think they can afford. And our case managers are very good at helping them arrive at those kind of decisions. And because I think gone are the days when you can say, you only need one, or things like that. It's got to be, well, we recommend this. And then whatever the patient does, the patient does. But it really, the standard has been very hard fought by USMCA, by the Lymphedema Advocacy Group. And it's important to follow it, because when we don't, if over time Medicare sees that, well, we're not dispensing 3 and 2, and we're not, people aren't coming back in, they're going to lower the standard. And none of us wants that, because with the way they've set pricing and the way that margins have come under a lot, I think we've had price increases from, I think maybe Juzo is the only manufacturer that hasn't increased prices this year. And last year, almost everybody increased at least once, if not twice. So being thoughtful about making sure that everything along the whole continuum of care is well organized is really important. And I think that since we've fought hard for this, imagine yourself in the patient's shoes. Would you want just one of something that you're going to wear every day? It's really not feasible. And we have patients that love this new 6-month standard, because it means that they can be building up an inventory of colors. It means they can be, and all of that equals compliance. Right. And it makes it that much less likely that they're going to end up back for treatment another time, because we've done a good job of setting them up for success when they go home at the end. So all of this has been assembled into a cheat sheet that is related to managing professional risk. And it just has some recommendations in terms of, how to make sure that, it's how to make sure that you're minimizing your own risk associated with the fact that we're sending patients home with a plan of care, and we're making recommendations to them. And know that we're not saying don't be involved in helping them, make their financial decisions, but don't make it for them is really what it comes down to. You can't anymore, because you're going to be held to, did you recommend the minimum standard or better? And so what we've tried to lay out for you is what would meet and or exceed the Medicare standard at this point as a base recommendation. And then obviously you customize based on each patient's unique situation. And I think anytime we're talking about, compliance, again, it's important to talk to your compliance folks and make sure that you're following any standards that are set by your clinic, your hospital system. Those may easily exceed what we're recommending in this cheat sheet. So just be aware of that. All right. So I think we've been tackling questions as they come, but this opportunity, if you have other questions about any of this, to just jump in there with them. This QR code will take you to a resources page where we have put together, assembled all the slides, all the video. Tomorrow, all the videos will be there. All the handouts, everything from every presentation today throughout the big day of training. This will all be readily available there. And you can use that QR code, or you can use, you'll get an email tomorrow that'll just link straight into it. So don't worry if you don't have it, if you can't grab the QR code. And you'll have access to everything. We've also got, I'm going to put the link one more time to the our Microsoft Teams virtual lounge that's going on all day today. If you have a question on this or another topic and you don't feel like you've gotten an answer to it today, jump in there. We've got folks, a bunch of people from Claudia's team are in there, and they're enjoying meeting all of you and putting faces with names and vice versa. And they can point you. They have a lot of links to things, and they can point you in any direction that you might need to go today. We've got related to these Medicare TP&E audits, there's the impacts on the written justification for customs and for accessories in the plan of care. But there's also a much bigger issue that is on us to help you deal with. We're going to be talking about that this afternoon at 5 o'clock Central in our 3 key trends for insurance coverage. If you can't make that at 5, go ahead and sign up for it, and then after the fact, you'll get a link so you can watch it whenever time allows. I think you'll find that one extremely informative, and it's going to really give you an idea of how these Medicare TP&E audits, how it's changing our paperwork requirements, and how we're working together with you to solve that. So I think it'll be pretty exciting. These cheat sheets have a lot of useful information, and I hope you can take a look at those. And if you have questions after you've had a chance to review it in detail, please just let us know, and we're always here to answer questions and help. Andrea is asking, when you use a wrap as a nighttime garment, do you bill for the accessory, the swell spot? I don't believe we do, because we're considering it the padding that meets the definition of the night garment.
Actually, we do bill it.
You bill it? Okay.
We bill it. The only exception to not having to have a pad or swell spot with a nighttime garment would be the hat and hem comfy waves, because they're
comfy waves automatically count, right?
Right. It automatically is counted as a nighttime garment, so that's the exception to that rule. But yes,
if you haven't seen the comfy wave, it's awesome. Yeah,
they are. So yes, the answer is we do bill for those.
But it doesn't increase. It does not increase the patient's.
No, it does not increase the cost to the patient, for sure.
And MediProfile.
Yeah,
but MediProfile is a night garment.
Well, it's padded, so yeah, that one's already padded. So
yeah,
the Tribute and Profile are padded already, but like if you wanted to use a wrap with
those aren't Velcro wraps
pad as a night garment, then yes, it's separate.
Yeah, excellent. Okay, not seeing any other questions, so I think we can wrap. But I want to make sure that everybody's got the link there to the Microsoft Teams virtual lounge. If you'd like to pop over there, if you have any other questions or you missed anything, any of these links, we can share all of these with you over there. And I know everybody'd love to meet you and say hi. So we appreciate you joining us. Hundreds of people participating in Big Day of Training today, and we couldn't be more excited to share on all these topics with you. We look forward to working with you. We thank you for all you're doing for patients, and we thank you for being part of Big Day of Training. We'll talk to you soon.
Thank you.